Welcome. Today we are reviewing a retrospective study on health outcomes following Atlas orthogonal chiropractic care. This presentation is based on a thematic analysis of the patient voice from 393 self-reports, authored by Dr. Joseph Iarano and Dr. Prof Ebrall, and published in the Journal of Upper Cervical Chiropractic Research in 2023. In chiropractic research, large-scale patient data is rare, and the patient's own voice is often muted. While previous large datasets have existed, the emphasis on evidence-based practice has often sidelined first-person accounts in favor of standardized, closed-ended tools such as the Neck Disability Index. By centering the patient voice, using patients' own words to describe their complaints and outcomes, this study takes a vital step toward genuinely patient-centered care. Atlas orthogonal traces its roots back to D.D. Palmer's concept that optimal nervous system function depends on normal spinal tone. B.J. Palmer later identified the craniocervical junction as the point of greatest tonal insult. Building on this, Roy Sweat founded Atlas orthogonal, or AO. The clinical process employs palpation and 3 specific radiographic views to define precise X, Y, and Z vector corrections. These are delivered by a mechanical percussion instrument to reseat the atlas, ensuring the head remains orthogonal to the neck and pelvis. To gather data, the Sweat Institute invited 300 AO chiropractors worldwide. 60 responded, submitting over 500 reports. After applying strict inclusion criteria, which require details such as the patient's own words, treatment duration, and pre- and post-treatment pain estimates, 407 reports were deemed viable. Following a final audit, 393 fully completed reports were retained for demographic and thematic analysis.
The 393 patients were predominantly female adults, with ages ranging from 6 months to 93 years. The female-to-male ratio was 2.64 to 1. Adults comprised roughly 69% of both the female and male cohorts, with closely matched mean ages of approximately 45 to 47 years. Presenting complaints were divided almost evenly between 2 categories. 54%, or 246 complaints, were classified as neurosomatic, primarily musculoskeletal conditions such as neck pain, back pain, and jaw pain. The remaining 46%, or 223 complaints, were neurofunctional, encompassing broader conditions including migraines, dizziness, trigeminal neuralgia, and Meniere's disease. The quantitative outcomes for acute patients were remarkable. Among 62 adults with an acute care duration of up to 6 weeks, the average duration of care was a mere 3.4 weeks. During this period, patients reported an average pain improvement of nearly 82%. On a 0 to 10 scale, the mean pain score fell dramatically from 8.2 at entry to 1.5 at the conclusion of care. When analyzing the patient's own words, themes of pain, restored quality of life, and transformative gratitude emerged as dominant. Out of 393 reports, experiences of pain was the most frequent theme, followed closely by years of chronic suffering and life's enjoyment restored. The pre- to post-treatment shifts were profound. Patients moved from severe, debilitating pain to pain becoming a mere memory, and from the threat of imminent surgery to the discovery of a non-surgical solution. The authors propose replacing the outdated 1979 framework that divided conditions into Type M for musculoskeletal and Type O for organic or visceral. In its place, they introduce neurosomatic for musculoskeletal presentations and neurofunctional for broader conditions. This new framework centers on nervous system interference. It acknowledges the upper cervical spine's unique neurological complexity, including its unattenuated communication with the vestibular system and direct thalamic input, offering a plausible mechanism for the broad-ranging outcomes reported.
In conclusion, the patient voice affirms consistent satisfaction, verbalized pain reduction, and functional restoration following Atlas orthogonal care. While these results are not inferential to chiropractic care in general, they underscore the profound value of listening to patients' own transformative experiences. Future work will pursue consecutive case mix sampling to further validate these findings with greater rigor. Thank you for watching. For further details, please consult the full article in the Journal of Upper Cervical Chiropractic Research and visit globalao.com for more information.